Hi everyone. For the disability pamphlet, my disability was juvenile diabetes, which is also called type 1 diabetes. The characteristics and kind of just the definition of juvenile diabetes, it is an autoimmune disease in which insulin-producing beta cells in the pancreas are mistakenly destroyed by the body's immune system. So they're destroying healthy cells in our body or in their body that is needed to take sugar in foods or glucose and transfer that into energy. The cause of juvenile diabetes is unknown. There is some research that looks into genetics and the fetus being exposed to different viruses, but there isn't any for sure information whether that is a cause or not. Some signs to look for are increased appetite. They are always thirsty. Maybe there's unexplained weight loss, fatigue, so just being extremely tired a lot of the times when it's not usual for them. Frequently need to urinate, and sometimes they can have fruity smelling breath. For medication for type 1 diabetes, insulin is always needed, so they always need to have a medication. Some types of insulin are, if they're being injected, they have rapid acting, short acting, intermediate acting, and long acting. There is also an option for an insulin pump. The resources that I found also talked about how treatment for diabetes includes having a good control of it to minimize the symptoms. So that would be checking blood sugar levels and taking your medication, eating a healthy, balanced diet, having regular physical activity, and regular medical checkups. More investigating and research is being done by doctors to find more alternative medicines and treatments for juvenile diabetes. Some education strategies that I found were positive peer support, so really instilling the having good rapport with their classmates, alternative seating arrangements, and flexible schedule, both for being able to go to the nurse when needed, so maybe they need to be closer to the door so it's more discreet for them to leave, or being able to leave at any time to go get a snack if they need to and check their blood sugar when needed. For social and emotional development, children with juvenile diabetes are more prone to behavior changes or mood swings if their blood sugar levels are not closely monitored. One example is that they can be more irritable when their blood sugar levels are not where they're supposed to be. And children may also wonder and ask questions such as, why are they different than their friends? Why do they have to always be careful and check their blood sugar and monitor what they're eating? Which kind of leads into the available services. One service that was talked about was talking to a counselor or a therapist just about how they're feeling about everything and different ways to cope with the different lifestyle that they are going to have to live with. Another service is having a nurse or qualified staff who is available to be able to help them check their blood sugar and give them their insulin when and if it is needed, or make sure that their insulin pump is set at the right dosage. For language and literacy, cognitive and sensory development, there's no research to show any deficiencies in children with juvenile diabetes versus or compared to their peers without a disability. And for physical development, from birth to 8 years old, there are no major differences in physical development between children with diabetes and their peers without a disability. However, long term, there are many complications that could possibly affect major organs, including the heart, nerves, eyes, and kidneys. But monitoring and controlling a normal blood sugar level can help minimize these risks. The two major sources that I was able to find a lot of my information on was the Juvenile Diabetes Research Foundation and the Mayo Clinic website. Thank you.